September is PAD Awareness Month. Peripheral artery disease is a common condition that affects more than 10 million people in the U.S., especially those over 50 with heart disease or diabetes. The vascular surgeons at Vascular Institute of San Antonio are specially trained to diagnose and treat this condition. Surgeons like Dr. Michael Peck here with me today. Thank you for having us.
Thank you.
And let's talk about what is peripheral artery disease and who is most at risk for it.
Sure, great question. So PAD, or peripheral artery disease, is a condition when the arteries get hardened and they can slowly close down. And these are the arteries pretty much all around the body. But when we say peripheral, we mean anywhere but the heart. So in the neck, in the legs, in the arms. And so it can cause lots of problems.
So anywhere but the heart then?
Well, it's the same condition in the heart, but they call that coronary artery disease, and that can lead to heart attacks. In the neck, it can lead to strokes, and in the legs, it can lead to wounds and sores and even a high risk of amputation.
Wow. Okay. So what are some common symptoms of PAD?
Sure. Well, that's the important thing, is not everybody has symptoms. So it's really important to back up and talk about the risk factors first. So people who are over 50, people who smoke, have diabetes, high blood pressure, and high cholesterol, that's kind of the combination of conditions that can lead to this, and it can slowly damage the arteries. And what it can do is, if an artery closes down, it can stop the circulation from getting to different parts of the body. So the circulation may not reach the feet and the toes and cause sores. It may block the blood flow to the muscles in the calf or the legs and cause cramping or aching. And it could lead to numbness, tingling, hair loss. And ultimately, if this isn't addressed early, it can lead to amputation.
Wow. Okay. So good to know all of that. So when should a person seek medical care for PAD, and how is it diagnosed?
Okay. So the most important thing is recognizing that you have some of these conditions that can lead to it. So if you have blood pressure problems, cholesterol problems, if you're a smoker, if you have diabetes, you need to manage all of these from an early stage so that it doesn't progress. So it's an ongoing thing that you need to manage. So you keep on managing it and controlling those conditions. Say stop smoking, control your diabetes. All of those things will reduce the risk long-term of getting it. But if you do get PAD, if you start to have these problems, you need to see a vascular surgeon for all of the possible treatment options. Medical management of it, whether it's changing your lifestyle and your habits. It can be stopping smoking. Sometimes it requires a procedure, like a minimally invasive procedure called an angiogram or arteriogram, where we give the patient some sedation and we go into the artery with a small catheter or tube, and we take pictures of the arteries and the circulation pretty much from the abdomen all the way down to the feet. And then if a wire can cross those blockages, we can open it up and restore the blood flow. So that's the hope, is we don't have to get beyond that point, but sometimes even the vascular surgeon would need to do a bypass surgery in the leg to pretty much create a new roadway for the blood.
Got it. So various different treatments then, depending on the symptoms.
Yes. Yeah. And the vascular surgeons in the community are the best trained for that, because we can do all of the different options, whether it's medical management, minimally invasive procedures, all the way up to the surgery, and unfortunately sometimes the amputations that are necessary to get infection out of the body and help people live longer and get healthy again.
All right. Well, thank you so much for all of that information. Sure. Very important to keep all of that in mind. The Vascular Institute of San Antonio has 12 locations throughout San Antonio and South Texas. For more information, you can give them a call, 210-962-5709, or visit the website vascularinstitutesa.com.